So welcome to this Module 4C presentation on aging and the mind. That is how the process of aging affects the human mind. By way of introduction, as we age, there's generally a slowing of nerve firing. So this results in a slowing of information processing and performing tasks. So the elderly person may not be able to respond to information or process information as quickly as the younger one. So they may not be able to think or perform tasks as quickly as they did before. Then older adults may also show signs of forgetfulness, which can be normal. However, when there seems to be many memory problems and forgetfulness seems to increase, this may be a sign of a more significant problem. They may also have a temporary change in mental function that comes about suddenly. Sudden changes in mental functioning and personality can be indicative of a disease process, not just a normal aging. Changes in mental function that appear suddenly and can be temporary can come from dehydration, urinary tract infection, fever, brain infection, such as meningitis, head injury. Maybe the elderly individual fell and hit his or her head against a hard surface. Could be due to stroke, could be due to low blood glucose, could even be due to alcohol or substance use, because there's some elderly persons who abuse these substances, and it could be interaction or side effects of medications. Now, if your patient has any sudden changes in their mental function, in their mood or their behavior, please do well, as always, to report to your supervisor. Now, working with an individual who has stroke. Other mental function changes that are more permanent can occur in elderly persons, example of which is stroke. Now, stroke or cerebrovascular accidents can occur when there is blockage in a cerebral artery in the brain, or if a blood vessel in the brain ruptures. So signs and symptoms of a stroke would include numbness or weakness in the face or in the arms or legs, especially on one side of the body. So stroke many times is on one side of the body, not always, but many times. Then the individual may also have difficulty in speaking. They may use inappropriate words, such as the wrong words for object or blood vision. The person can look at a cup and call it television. Or the person may want to sit and give you another word entirely. May want to pee and tell you he or she wants to cough. So they begin to mix up words, mix up actions, mix up words for objects. Or they may have a new onset blurred vision. Again, if you do observe any of these signs, you know what to do. Inform your supervisor. And here's a picture of an elderly man with a drooping of one side of the face, and here's the caregiver putting a call through to the supervisor. This is what will be expected of you should your elderly client experience any of this. Now, sometimes the effects of stroke are temporary and the person may regain normal functioning. But in other cases, there may be permanent changes within the brain and body. So careful attention must be paid while you're caring for a patient after a stroke. If your patient has lost the ability to use one side of the body, you want to encourage the use of the stronger side by placing eating and writing utensils on the strongest side. If your patient has developed speech or swallowing problems, sometimes a speech therapist may become involved in the patient's care. What they do is to evaluate the patient's ability to speak and to swallow. And you, the caregiver, have to be patient while you're communicating with your clients. Now, if your patient has swallowing problems, many times a special diet will need to be followed, and liquids may need to be taken to prevent choking. A patient who has suffered a stroke may also have vision problems. They may only be able to see half of what is in their field of vision. So you want to approach the patient from the stronger side where the vision is clearer. You place items they need on the side they can see and ensure that they always know what is in front of them, especially when they are walking, in order to prevent tripping and falling. Now, how do you work with a patient with Alzheimer's disease? Alzheimer's disease is a disease that affects the brain, and what it does is to cause permanent and progressive. Progressive means it continues to get worse. Progressive changes in the brain is the most common form of dementia. Dementia means the loss of ability to think, to remember, to reason, and to plan tasks in the elderly. So symptoms of Alzheimer's start out typically with memory loss. But as it progresses, the person becomes very confused. They may forget their family, who they are, and they may become unable to care for themselves. They may lose the ability to communicate, and they may have personality changes such as aggression, withdrawal. Now, a person with Alzheimer's disease needs special care. So it's important that you, the caregiver, provide a safe environment such that they don't get lost within their own homes. You don't keep objects along their path so that in the process of walking, and bear in mind, this is not someone, these are elderly people who have lost their ability to think, to remember, to reason, to plan. So they don't bump into things and play with harmful objects. They may play with knives because they've forgotten that knives are dangerous or knives are sharp objects. They may want to comb their hair with knife or with fork. So you have to be sure that you provide a safe environment within their house. They may wander and end up in an unknown place with no memory of who they are, how they got there, where they are, or how to get back home. So if you care for such elderly individuals, you want to really put an eye on them to prevent them wandering off under your watch. Here's a picture of an elderly woman pointing at some notes on the wall and struggling to remember what is written, let alone even be able to comprehend it. So it's also important to try to prevent things such as fire, because a person with Alzheimer's may begin to cook and forget they have foods on the stove. So you want to write lists and label objects throughout the house because it helps them to remember what objects are. So you write knife on knife, write kettle on kettle, so they know kettle is for boiling water and not for bathing in the bathroom. And it may even be helpful to place a note on the mirror with the patient's name or a label such as myself, if they are at the point where they no longer remember who they themselves are. So you can even place their name on the mirror. So when they go into the mirror, they see their name, I am Diana Jones. So you want to remember to be patient and encouraging and find the things that seems to bring the most comfort to your patient, and you do these things with your patients. Now, working with a patient with Parkinson's disease. Parkinson is also progressive, and it's an incurable disease of the mind with permanent changes. Now, people with Parkinson's disease oftentimes will have difficulty initiating movements, such as walking, and they may also have tremors, which makes it difficult to perform daily tasks, such as feeding and dressing themselves. Their muscles may become stiff. The person may have a shuffling gait, and eventually it may progress to a point where they can no longer walk. Now, dementia may occur along with Parkinson's disease as it progresses. So when you're caring for a patient with Parkinson's disease, you want to remember to be patient. It's frustrating for them to be unable to care for themselves. So you want to encourage them to do as much as possible and assist them with activities of daily living as needed. Now, when you're preparing food, you want to keep in mind to prepare food that is easier for the patient to handle. You want to use adaptive utensils, plates, and cups that can make the eating experience more pleasurable and successful for your patient. Remember, the goal is independence. And here we have an elderly man with a working head for standing by him, the caregiver. Now we discuss stress and the elderly. There is a picture of an elderly person looking stressed, gazing at his computer. By way of introduction, a stressor is anything that causes stress. Positive life events such as birth of a baby or a wedding can cause people stress. So a stressor is not necessarily something bad. Life events such as wedding, divorce, death, birth of children, birth of grandchildren retirement can cause people stress. Additional stressors affecting the elderly may include some financial problems, death of a spouse, death of a family member, death of a close friend, or physical changes in the body, inability, loss of their former ability to walk, needing to use hearing aids before they can hear people, or pains. Elderly people many times will experience some form of chronic pain, could be from arthritis, and the fact that they've lost some degree of their independence. Now, when we feel stress, adrenaline is released by the endocrine system, and it causes our blood pressure, our heart rate, and respiratory rate to increase. Stress that is not relieved can result in long-term physical problems such as high blood pressure. It can also cause anxiety, depression, aggression, even mood swing in your elderly patients. So some elderly people, patients, generally everybody may begin to manage stress by engaging in unhealthy behaviors such as overeating, smoking, or yelling at those near them or drinking alcohol. So how do you then help your patients to manage stress? One is to encourage and provide healthy, nutritious meal. Then you want to encourage and work with the patient on maintaining physical activity, or you want to incorporate an exercise plan into their daily activities. You want to ensure that your patient is having adequate sleep. So the sleeping environment should be peaceful and quiet. Then you want to find activities that your patient enjoy. Some persons may enjoy reading, some persons may enjoy listening to music, some persons may enjoy watching movies or spending time with their friends, and you want to encourage such pleasurable activities. Then you want to teach your patients relaxation techniques such as deep breathing. Some patients will benefit from warm bath and back massages. Then application of lotion to the patient's leg and hand, if they wish, may also be a form of stress relief. For someone who is religious and of the same faith with you, you may want to offer to pray for them if your patient is disposed to such, or you may want to organize their clergy visit if it's someone who is religious and disposed to such. Then you want to allow the patient space to be alone for a short period of time to relax and think. And you also want to provide space and time for your patient to talk. And while they talk, you want to encourage them to express their feelings, their emotions, just so that they can begin to unravel whatever it is that may be stressing them. And with that, we come to the end of this presentation. And as always, thank you for staying with me. Bye.